So, Dr. Sonali, welcome you on the platform of Happy Doctor Foundation.
Thank you
And
so much.
as you are aware, Happy Doctor Foundation has got only one aim, and that is to make doctors happy. At the same time, make patients also happy. Because we feel that if doctor is happy between doctor and patient, only doctor is happy, then that is not a good situation. And if only patient is happy and doctor is not happy, then again that is not a good situation. So we are finding out a balancing environment wherein doctor is also happy and patient is also happy. Okay.
Right.
And I thank you for taking out your time in sharing your experience. So can you tell us about how you started your practice, how long you are into practice?
Okay. Hello everyone. I'm Dr. Sonali Jain here, and I am a dental surgeon. I am a gold medalist, and I am practicing since the last 12 and a half years now. I don't have any medicals in my family. Mostly everyone's a chartered accountant. So my family was very inclined that I also end up studying the same. But as always, I was always inclined towards the medical sector, always fascinated by dentists per se. The main story originating from my own dental experiences as a child. So, as a child, me and my brother had to undergo a lot of dental treatment. So, my mother always used to take us to the dentist, and possibly that could also be one of the reasons why my brain got
You
remodeled.
fell in love with the dentistry right from childhood.
Possibly, yes, yes, yes. A
Great.
dentist office was always like, second home for a couple of years
Oh,
for us per se. So from that, I think I got remodeled early on. And yeah, so that's how my journey began. I took admission in IMT Dental College in Kharghar. I topped my college. I took my internship in St. George Hospital, that is Government Dental College in Fort. I completed my internship from there, and that's how I started working. I started working with established practitioners early on to learn the ropes of clinical dentistry per se, because as such college dentistry and out of the कॉलेज जो एक्चुअल डेंटिस्ट्री है थोड़ा सा गैप है वहां पे so then I started learning. My journey began from there, and I started my own dental clinic, which is Smile 360 Dental Clinic, in
okay.
2017, and I'm based out of Dahisar.
So you are practicing at only one place in Dahisar, right from
Yes, sir.
2017,
Yes, sir. Full
right?
time here and attached to Manav Kalyan Kendra since the last 8 years or so.
Okay, okay, okay. So in your initial days, what problems you faced in setting up your practice, getting patients?
Um, So I would say touch wood for me, things have been quite decent from day one. So because मुझे सब बोलते थे कि early on you will end up facing a lot of wait time, a lot of downtime in your own clinic and things like that. But before 2017, so right from 2010 to 2017, these 7 years also I have practiced in and around Mira Road to Borivali.
Oh,
So I built up quite a good network of patients. Definitely, I feel with my hard skills and with my soft skills, my patients used to trust me. They still do. Used to trust me a lot. So, and also I harness the power of social media marketing to quite an extent. So, thankfully for me, things were okay, I would say. I did not end up facing a lot of wait time or
right.
things like that. It started quite well, and touchwood till date, things have been quite decent, upward and onward, right from the
Great,
beginning.
great, great. Really, congratulations. And in our Happy Doctor Foundation's teachings and classes, now we always tell that doctors have got these myths and fear in their mind. Whether I will get patient or no, whether I should start, or there are many other dentists around me. Then that kind of fear, more than fear, it is a myth, and that
Right.
prevents young dental doctors from starting their practice. But you are a living example that, in spite of nobody in your family being a doctor,
Right.
Okay, you started and you build your career. Okay, that's really nice. And as far as your digital media platforms is concerned, that must be since last 4 5 years,
Yes, sir. Right.
right?
Not exactly 4 5 years. It's been around since the last 2 or 3 years only, I would say. So early on, I was not very active on my social media platforms, neither Google, Facebook, Instagram.
Right.
I was not really active anywhere. But post during the COVID pandemic, because
Yes.
we all were forced to stay inside. So in those 20 25 days, first 20 25 days of our lockdown, we were
Right.
all in a dilemma, right? Early 2 3 days, we were all like, okay, this is a vacation and how things will go.
Yes.
But I am a person who really wants to learn. I can't sit idle. It's like that. So I was like, "Okay, why not me?" I started watching some videos on YouTube and started following a couple of people and even doctors who were teaching social media marketing, who were teaching digital marketing and things like that. So I was like, there's no harm in learning anything. I may or may not put it to good use, but I always want to learn. So cooking and watching YouTube videos and doing a lot of
Yes.
cooking and watching a lot of digital media marketing lessons is all that I used to do during
Right.
the
Right.
pandemic lockdown when we all were forced to
Great.
sit inside. That is when I created my Instagram account of Smile 360 Dental Clinic. I started
Right.
creating a Facebook account of Smile 360 Dental Clinic, and I just started putting informative videos out there as to what exactly is a root canal, how does a wisdom tooth give you trouble, what can be done out of it. I just started putting some videos there. I started putting some videos of our clinic day to day life and things like that. And it really made my audience very happy. So, all the existing patients who, and
Yes.
my friends and family members, even doctors fraternity who used to watch it, used to always tell me, oh, we like your post. Till date, they tell me, whatever you put, sometimes it's funny, sometimes it's some serious
Right.
topic. So it's engaging. And that's what
Right.
keeps me motivated as well. That, okay, people are liking it. So I will definitely continue this process.
Right. Very nice. In Happy Doctor Foundation, we have got one special module on YouTube Mastery. In that
Okay.
we, yeah, in that we tell you how to post videos on YouTube. Okay, because as
Okay.
a doctor, we post videos on YouTube, and it is like one doctor giving a lecture to other doctor or to medical student, but it should happen
Okay.
in a vernacular way so that
Okay.
common man should understand. Would you
Right.
like to attend our today evening workshop? I will send you a
Definitely,
link.
sir.
Okay, so I will say
100%.
great, great. I will send you the link and you can register. We have got actually it's an orientation program to all the doctor on Happy Doctor Foundation activity. Okay, so
Okay.
you can take your part and I will send you that link. Now
Sure, I'll be happy to join.
one thing I would like to tell you to other doctors that when they want to start, number one is how much budget they should go around. Okay, because usually what they think that to start dental practice, the dental chair and the equipment is costly. So
Right.
many dental doctors, they are hesitant to jump into private immediately after passing out. And
Right.
afterwards,
Right.
what happens? No, once they have taken the job, then they go in that cycle of the job only. Then they are not ready to come out of that job cycle.
Right. Right.
So, what is your, own experience and guidance? What you can tell them?
Okay. So, sir, according to whatever I have witnessed, also I have two associate doctors working at my clinic as well who have cleared from their college and around 2 years into their practice. So they cleared in 2020 and 21 and are working under me in turning, learning and implementing
Yeah.
under me. So what I would highly recommend to freshly passed out doctors is that first couple of years, let's say around 2 years or so at least, your should be your incubation period, and you should always have that itch to keep learning constantly. So work under good experienced doctors and see how see, I mean, at the college level, things are taught in a clinical manner as to how to do this procedure. But
Yes.
first things first, how will you gain the patient's trust? You first have to be able to explain them what you're going to do and why they should be ready to do it with you. You have to first make them understand that you are competent enough. Early on, that will be required. Later on, definitely it's not required at all. Patients will come to you because they know your work is good.
Yes.
They have seen it at places, they've heard it from people. So that way it works well. But early on, first 2 to 3 years, your focus should entirely be on learning new advanced things, because definitely dentistry is evolving by the day. So many new things, every single aspect is digitally driven in dentistry these days. So what will this digital dentistry do? At the end of the day,
Yeah.
it will make the outcome more better. Who is going
Yes.
to benefit out of it? The
Right.
patients, definitely. The patients are going to definitely benefit out of it 100%. But at the same time, as doctors are also going to benefit out of it. Our downtime, our chair time will be reduced, our backaches will be reduced, right? We'll have more time to spend with our family that
Yeah.
way. So it's a win-win for both. So digitally driven dentistry is, I mean, it is what it is. That's what we need to adapt and accept with. So early on, I would recommend all fresher dentists to have their incubation period, work at good clinics, learn the ropes of communication.
You're right.
Hard skills college से आपने सीख लिया, but soft skills का क्या?
Yes.
Nobody is
Yes.
really teaching you that.
Yeah.
So learn the soft skills, learn the digital dentistry, that which is the era right now,
Right.
वैसे. And then possibly, um, uh, and so also for females, I would like to say that preferably they can wait a bit, because see, initially it takes a lot to set up a dental clinic in terms of finances, financially, emotionally,
Yes.
in every way you have to be ready. And then ऐसा नहीं होना चाहिए that because marriage takes you to places, right? And if
Right.
you are
Right.
having a big jump in distance of your place of origin, it's always preferable that initially that thing also gets cleared. It doesn't come in the way, or ultimately then if you plan to shift your clinic to from
Yes.
place A to place B, which is quite far from each other, so थोड़ा सा वो एक रहता है that आपकी practice may break a little.
Right. Right.
वैसा है. So that is also one of the things, practical levels पे देखने जाएंगे. So this is also one of the things to keep in mind. And otherwise, I would say for a small clinic with one dental chair and operatory and everything around, this is just a very, very rough figure, and it can keep going higher. It can keep getting lower also depending on the kind of inventory we are investing in. But something which is like, a decent dental chair with digital x-rays.
What will be the minimum costing, to start your basic dental setup?
I have a
Basic
feeling
minimum to minimum. How much?
very basic dental setup with some digital things in place
Yes.
would cost somewhere around, say, around 10 lakh rupees.
Oh.
With some really basic interior chair and a digital x-ray. And then it can keep going higher as you start investing in lasers and implant
Yes.
inventory
Yeah.
and scanners and things like that. So there is no upward limit. It can go up
Yes.
to 80 lakhs to 1 CR as well.
Right.
Plus the cost of a place acquisition that
Yes.
I'm not even considering right now
Yes. Yes.
as we talk, because that can vary from place to place in our entire country.
Right. Right. So quite a nice journey you had, and it was very successful. And that's what we say, that you had a passion for dentistry. Okay. And
100%.
whenever, yeah, and whenever you
all
are,
my senior doctors, my parents, I'm so grateful. I'm always thankful to God, all the doctors who support me, even you for that matter, sir. It's like, my parents, everyone. I'm very grateful for all the opportunities that I get.
great, great. Happy Doctor Foundation is always with you, and be in touch with us and take part in our activities. So today's link
Yes.
I will send you. Okay.
Yes, sir.
And
Yes, sir.
yeah, so definitely you will have a big future, and do will take some yours and ours association further in the digital
Yes, sir.
platform. Okay,
Yes, sir.
so with all the best wishes, I will take your leave, and
Thank you so much, sir.
thank you for taking out your time. Okay,
Thanks a lot.
bye, take care.
Thank you, sir. Bye. Take